So, very welcome to everyone. I know a lot of you are joining as I speak and fixing their the internet or laptop and trying to find the link. So, we have a very special guest with us today. I will be introducing him in a very short in a short time, and I'm very delighted that APPNA has provided a platform for the doctors and entrepreneurs and the people with a special success history to come and share their experiences, their knowledge. So people like us get more and more, you know, um, to see that how we can improve ourselves in our faculty, in our environment, in our job place, in our workplace. So now it's 2 minutes past. So I formally welcome you, everyone. From I'm based in Toronto, Canada. Dr. Uzair is with us. He's our backbone for this APPNA MERIT program, and we have a very strong team led by Waleed. Without him, I think we will not be able to perform what we do. Um, so along with that, I know people are joining from different, not countries, but continents. So from Pakistan, Europe, and America, Canada, and also Middle East. And we have seen and we have noticed in the comments. So without further delay, I would like to introduce Dr. Immad Qureshi. He's one of the graduates of Army Medical College, did his master's in critical care, and then he's currently working as a consultant in emergency medicine and clinical governance lead, Isle of Wight, NHS Trust, UK. So a graduate of Army, as I mentioned, and he is currently he did his critical care fellowship from Cardiff University, and also he is also a fellow of Royal College of Emergency Medicine by examination. Until recently, I mean, he served as a trustee, board member of RCEM and chair of Emergency Medicine SARS Forum, and representing the specialty on the Royal College Emergency Medicine Council, which is a big honor for being a Pakistani representing themselves or himself on such a forum. He's also not only in the field of medicine, but he's also founding director and general secretary of the British and Irish Pakistani Emergency Physician Associations, and also he's the UK liaison for our ambassador program and representation of Royal College of Emergency Medicine. So I would like to welcome Dr. Qureshi, and before I let him speak, he's not only good at what he's working in his academia, but he was, when we were chatting, I came to know that when the Olympics came to 22, he was one of the umpires of the table tennis match. So very welcome, Dr. Immad Qureshi. I'm hoping, and we are hoping, that we will learn from your experience today.
Jazakallah. Assalamu alaikum, everyone, and thank you very much, Professor Akhtar, for such a warm and kind introduction. In all praises to Allah, everything is because of Him, and you never feel that you are worthy of such praise and such respect, but Alhamdulillah that you have it. And that is also part of what I'm going to talk about today. So I'll just start sharing my slides, and thank you so much. So it was, as you said, it was the Commonwealth Games in Birmingham 2022
Yeah,
when they
sorry about that.
happened.
It's a Commonwealth Games. Yeah.
And I was an international umpire. I was representing England at the time, but since then I've changed, and now whenever I'm umpiring at the international stage, I'm representing Pakistan, my birth country, which is a very big sense of pride for me as well. And also, interestingly, at the moment, I'm the only active international umpire from Pakistan within the International Table Tennis Federation community. So, with that, I hope that you can see my slide.
Yes.
Please just let me know if you can. And
Yes.
right. So, are you going to spotlight me, Dr. Zair?
Yeah, yeah, it is perfectly okay. Yeah, you
Okay,
can go
perfect.
ahead,
That's
please.
great. So I'm just I'm going to talk today a little bit about my leadership journey, and beyond my leadership journey, I'm going to talk about my struggles with imposter syndrome, a little bit about my struggles with burnout. I'll share some personal anecdotes and my life story with you, hopefully so that people who are listening can learn some lessons that I have had to learn through grief and loss and burnout, that you might not have to go through all of those experiences, and you can take my lived experiences as a way to learn those same lessons and to excel and progress and improve yourselves in your careers. So when Dr. Jabin invited me or asked me if I could prepare something, um, this is what we came up with. So, started with holding a stethoscope. But if we think about how you decided or how you started developing skills, it starts well before that. So I'll just give you a little bit of an introduction about myself. And I don't have massive slides with words on them. There might be some slides with a lot of pictograms, which might be a little bit busy. But don't worry, you can have all of my slides afterwards if you'd like. So please talk about how we become who we are, or how I became who I am. I guess the important thing here is that to let you all know, I was born in CMH Muzaffarabad in Azad Kashmir. And when I was 10 months old, my parents moved to Saudi Arabia, and I did all of my initial schooling in Saudi Arabia. And while I was doing my GCSEs and A levels, I was fairly intelligent chap, always topping the class. It was a very small class to begin with. It's about 18 students, and I would always be the top student. And everybody is telling me that you're quite intelligent. But it was always about what do I do with that intelligence, and do I help other people along the way as well? So what I started to do, we had a physics teacher who used to teach us practicals, who was trained in the UK and educated in the UK. And one thing we got to see was that if he wasn't teaching practicals, but he was teaching us theory of physics in GCSEs and A levels, some of it didn't quite make sense. Or sometimes the theory wasn't what the book was saying. It could even be wrong at times. So I took it upon myself that after every physics lesson we had in school, I would take the whole class to the library and I would reteach that lesson, even though I was at the same level as those classmates of mine and I was learning the same thing as them. But I felt that I'd already read before coming to the lesson, and then I'd listen to what the teacher said, and anything that I felt didn't make sense, I would underline it or write it down somewhere, and then I'd teach those lessons again, and just felt that teaching was quite a core part of who I was and who I wanted to become in the future. Anyways, I always wanted to be a physicist, so maybe that's where my passion for that came from. But being born into an Asian family, a Pakistani family, my parents pushed me into medicine, and I went to study medicine. And in medical school, I remember that during my first year, we didn't have a professional exam. We had a promotion exam between first year and second year of MBBS. And I remember giving a speech in our class, which 6 or 7 years down the line, you guys might have heard in an Indian movie called Three Idiots. So I remember going on stage and saying to everybody, we've all gotten into medical school and, we're all going to graduate as doctors because that's what they say. If you get into medical school, you will all graduate as doctors. But it's now dependent on us what kind of doctors we become. So if you engage in selective study or exam-oriented study so that you study all the topics that are going likely to come in the exams, you're going to pass the exams and you might score very highly as well. But what about the patient that comes to you that has a condition that you didn't study because you didn't feel it was important for the exam? So please be thorough, read everything, study well, and be good doctors rather than qualified doctors. So uh, maybe again, I was preaching things or I was talking about things that weren't that commonly said at that time. But then life progressed and I graduated. I came to Saudi Arabia after I finished my house job. And I started working in emergency medicine in 2006, a small district general hospital in Saudi Arabia. Then I moved to the National Guards of Saudi Arabia and a bit of a leadership journey. Eventually, I found myself in the UK in 2014. And by 2017, I'd finished my exams and I had completed FRCEM. And then I started taking on additional roles. So we'll talk a little bit about those as well. In that that first job in Saudi Arabia, small DGH, no real trained emergency physicians, and I saw some practices that I felt were not best practice. So I would say to my colleagues, I think we need to change. We need guidelines. So I volunteered to write guidelines and have the specialists, like the medical specialists and the orthopedic specialists and the general surgeons, ratify those guidelines so that everybody was treating patients the same. It wasn't something I was paid to do. It wasn't something that I had to do, I felt because if I was just managing the patients correctly myself, none of my patients would come to harm. But even then, in my first job after my house job, I was quite keen that patients should not suffer. We should be providing a standardized level of care. And again, maybe that is a sign of somebody who doesn't want to just be a provider, who wants to improve things. And so my first lesson to everybody is you don't have to be a leader or you don't have to have a title of a leader to bring about change. You can always affect change in whatever capacity you are, just trying to make things better. Anyways, after this, I joined the National Guards, and after some time, I became the coordinator for an urgent care center over there. I was the youngest person on the team, the youngest doctor, and they made me the coordinator. And the reason they made me the coordinator was the clinic director felt that if the youngest person was given this role, then he could tell me what he wanted and I would do it without asking too many questions. What he didn't realize was that I had a very strong sense of doing the right thing. And so occasionally he'd ask me to do something which I felt wasn't in patient interest or was a patient safety risk. And I would challenge him on his ways of wanting things done. And as the journey progressed, like I said, I took on other roles, and we'll talk about those as we progress in this talk and this conversation. I guess you'll be thinking why I've put this screen up, but if you decide that you want to improve things, if you decide that you are not satisfied with just going into work, doing your shifts, and coming home, then what we imagine work-life balance being is absolutely nothing like it is on the top. And most of you will have experienced this. In reality, we're juggling so many different things that work-life balance is a struggle, if anything. And in trying to juggle all those things, another factor that you have to consider is FOMO. So people who might have anxiety, who might have ADHD, it may be undiagnosed. I believe in my case, it might be. Uh, they suffer from this very strong fear of missing out. And whenever an opportunity comes their way, they struggle to say no. And so they keep adding more and more things. And then as they add more and more things, at some point you're going to tip the balance and everything will come crashing down. But why do we do those things? Why do people want to take on more and more? It's because inherently, if you think about what kind of people go into medicine, they're very intelligent, they're very hardworking, they're dedicated, they get good grades, so they're highly intelligent. They're probably very smart people. And smart people have some characteristics that you can often find in them. So they enjoy learning. They're great at noticing patterns. So if you give them an IQ test, they'll probably score very highly. You know, they're not ashamed of learning from whoever it is that can teach them something. So they will go to the person with any job and ask them to explain it to them, and they'll learn it. And they'll learn it really well because they'll have learned it from somebody who's a master at doing it. Um, Now, often they can understand things that are quite complicated, and they can understand it and explain it quite easily, which is something that I did realize. And these other features also show up. So some of these things, which again, I remember the anecdotes from my own life, and I already talked about teaching physics at school or the promotions exams. But then you also had to realize that I didn't know everything. And maybe I wasn't that smart as I thought, because I came from a school that there were 18 students in my class and I used to top. And then I went to Army Medical College and everybody there was a topper. And I wasn't even in the top 10 or 15 in my class when the results came out. Maybe because I had a different way of studying, but also it was just I was surrounded by very intelligent people. Did that make me less intelligent? Probably not, but it was difficult for an 18-year-old student to understand that. Other things that I was good at remembering facts. I was good at teaching things, and I found that teaching was a great way for me to learn. Also realized that you can have a debate and you're not always going to be right, and it's okay not having all those answers. And all of those things helped shape the kind of person that I was going to be. But most importantly, what that did for me is it helped me gather a self-awareness, an understanding of what kind of person I was. I came to realize what my core values and beliefs were quite early on. I wanted to help other people be the best versions of themselves that they could be. Um, that's why I would teach physics. That's why I would speak to people about what they were doing. Um, I was very passionate about mentoring. I was very passionate about teaching. My goals and aspirations were to be a good person, but I was also fair, I believe. Another story that I remember uh, was my final year ophthalmology viva, and it was being taken by the late Shaheed General Mushtaq Beg, who was ophthalmology advisor for the Pakistan Army. And I went and sat down and he asked me, Beta, where are you from? I said, I'm from Muzaffarabad. He says, okay. And is that where your parents are and that where you go on the weekends? And I said, no, actually, my parents live in Saudi Arabia. He says, you've passed all your send-ups and your terms, exams and everything. I said, yes, sir, I've been studying hard. He goes, okay, beta, you can go. I said, so what about my viva? He says, beta, your parents are sat in Saudi Arabia. They're making dua for you. Do you think I can fail you in this exam? And don't know what it was. Maybe it were those core values and beliefs, but I replied to him and I said, I'm really sorry, sir, but that's unfair to everybody else. Don't you think everybody's parents are making dua for them to pass this exam? And if you're going to not take a viva from everybody, that's fair. If you're going to ask them questions, then you have to take a viva from me as well. Now, I realize that this could have been a very risky thing to say, but I believe that that is what integrity and courage is. Integrity is doing the right thing even when no one's watching, and courage is probably telling the truth even when it can harm you. So, anyways, the professor listened to me. He gave a little smile and he said, okay, beta, tell me the definition of diplopia. I said, that's easy, sir. Diplopia is double vision. And he goes, right, your viva's over. You can go. I ended up passing that exam. But I felt happier about the fact that I didn't take the shortcut and I advocated for all of my colleagues and all of my classmates when I was there, when I was presented with an opportunity to do so. But then life started, and as you go through life, you often begin to realize that it's not easy, is it? Especially when I went to Saudi Arabia as a foreigner, as an expat doctor, or when I came to the UK and I started working as a SAS doctor, a specialty doctor, which is like a medical officer in Pakistan. You're not in a training post, you're not on a clear pathway to become a consultant. And I started to feel that I need to prove myself. And if there were any days that I wasn't really being productive, it felt like I was useless. And a lot of the times, because that is as we're growing up in our cultures in Pakistan, India, around the world, uh, that is part of it. You're being made to believe that you're only going to be worthy when you are doing useful stuff, when you are productive. But you need to step back and realize that everybody is already worthy from the day they were born. You should never have to prove that. Just something to ponder on and pause for a little bit. But then, as you move along in your career, you realize that, there's a lot you don't know. So we've all seen the competence chart where, your knowledge and your um, insight about to how knowledgeable you are. It goes through different phases when you're the novice, or when you are incompetent, incompetence, or competent, incompetence, etc. But here's a slightly different graph, which tells you a little bit more about growth as it is, and this scary road to competence. Because initially, um, as a new doctor, you haven't faced complications. You've not faced patients who don't do well despite your best efforts. And you realize that, oh, everything is really easy. So you're very, very sure of yourself, even if you don't have that knowledge, because you don't know what you don't know. And then you start to realize how much you really don't know. And that's where your conviction starts to go downhill. But becoming competent and growing comes from overcoming that shame, that fear of not knowing. That's when you actively start on that path of learning and knowing more and working on yourself. Because imagine if you get stuck in that insecure canyon, you'll probably stop, because you're going to feel that you're not good enough, you're not worthy, you're not qualified. But you're only going to grow, you're only going to see improvement in yourself when you start doing those things that you aren't qualified yet to do. That is what training, that is what self-improvement is all about, isn't it? And then as you continue through that journey, you also realize that all those feelings that you have, they're valid. It doesn't mean that they shouldn't be there or that they're not there. You have to live with the acceptance that even if it is in your head, it doesn't negate the fact that your experiences are real and valid. Yes, you shouldn't feel in a particular way, but if you do, there must be a reason why you're feeling that way. So how are you going to make things better? A big part of working as a professional and slowly learning and becoming a leader is to deal with difference of professional opinions. It takes a lot of effort and time to realize that a difference of professional opinion is not a personal disagreement, and you continue to work with colleagues after that. Some of my best friends I have very, very serious and heated debates with. But at the end of the day, we realize that we're coming from a safe place, we're coming from a place of respect, and we have strong opinions about what we're talking about. But in the workplace, it's professional opinions, and we move on. So if I were to then ask you all, how does somebody become a leader? Are they born a leader? Is it something that you can learn? Even more importantly than if it's something that you can learn, how do people show that they are leaders? Is it big titles? Is it what they do? Are they, just talented in that way? And it's not. If you look at things, you'll see that it's very small things that they do on a daily way in their daily routines that makes them leaders, that gives them influence over people. So the one big thing that I started doing as I became more senior was I would never ask people how they were or how they were doing if I didn't have the time to wait and listen to their response. You know, when you pass somebody in the corner and you go, "Hey, how are you doing?" And they go, "Yeah, I'm okay." And you just walk past. No, you stop and you ask them how they're doing and you wait for their response. And you try and read their body language. You try and read the tone of their voice. And you give them that genuine time that they need if you feel that you need to ask them a second time. You go, "I'm sorry, again, how are you doing? Are you okay? What's happening with you?" And giving people that importance builds that trust. What you end up with is, if you've heard of the concept of an emotional bank account with people, so your relationship bank with people has the currency of emotion and trust and care. And every time you do some small act of kindness or show them that you care about them or they're important to you, you end up putting money into that or putting currency into that account so that if someday you are having a bad day and your behavior is not optimal or it's not ideal, you end up being incivil, for example, or you snap, they will remember how much you have in that account. So even though you've taken a deposit out of it, it's still a positive balance and your relationships don't suffer. So just consider how leaders do those small things every day. And I'm sure you'll have lots of examples in your careers as well. I learned this when I used to do clinical governance, for example. And my big challenge was that clinical governance has to be done in the context of psychological safety. And it was never about subjecting people to an investigation. Every time I spoke to people about an investigation, I'd say, "There's been an incident and I'm really trying to understand what happened. So would you have time to speak to me and explain to me what happened in from your reflection or your how you remember the event so that I can understand how we came to the decisions we made and what systems should have been in place that weren't, that could have prevented this incident from happening." So nothing in that is putting any blame on that person who I'm speaking to. Stopped the culture of taking written statements, for example, for incidents or complaints, because that's very, very stressful for, especially for people who are more junior to you in their careers. Guess just living by this principle, maybe, um, try and make yourself as a leader, as a manager, as a clinician, as a human being so good that people who are not in the room know that you would have been kind. People who have not heard what you said know that you would have said good things. Be the kind of mentor that you wish you had when you were going through that stage every time you're talking to somebody. And when I sit back and reflect on my journey, and I'm sure you all would, you consider how often we set a goal and we feel that it's a straight path to achieving it, but it isn't. And that's where you set a goal and you start out trying to achieve it. And then all that doubt and those feelings of inadequacy come in, but then you learn to get past it. And then if you're taking exams, you may end up failing your exams, for example, but then you improve, you practice more, you prepare more. At some stage, you're going to feel like you don't know where you are or what you're doing, but eventually you will achieve. What can help you in your job and what can really be useful is knowing where you are on the ladder to join work. And I find that this is probably one of the best infographics I have, because every time I feel like I'm not enjoying being at work, I don't want to be at work, I try and find out where I am on this ladder, because you can't go from being stressed to being excited about work. You've got to go up the ladder step by step. And you've got to be able to recognize when yourself or a colleague is slipping down this ladder as well, so that you can intervene and you can support them. But if we talk about supporting colleagues, think about who supported you. Think about those bosses that you had who were really good for you. And I'm sure you're going to think about people who made you feel valued, who knew your name, who would ask about your life, who would check in on you. But also, the ones that really helped you to grow were the ones that not only valued you, but they also ensured that you added value to whatever the team was doing. And really, those are the kind of bosses that we remember, and those are the kind of bosses we should try to be. So be that person who defends you, defends their team when it's needed, who help other people develop as leaders, who tell them what a good job they're doing, and when they've done something wrong, who fix the problem, not apportion blame. Should we just give a quick pause here to see how we're doing, or should I carry on, Dr. Zair and Professor Akhtar?
It's up to you. You can carry on, and we can have once you're done, we can have a more interactive discussion.
Okay,
If
sure,
you want,
perfect.
you can finish a little early so we can have a few questions answer session.
Sure thing, no problem. So, but then my own story I wanted to talk about was imposter syndrome and my anxieties and my struggle with burnout and personal loss. And this is very real. I mean, a lot of us go through this where you realize that, there's that feeling of inadequacy, feeling that you don't deserve to be where you are. I felt that I've probably always had this, but the more senior and the more I've progressed in my career as a leader, as a clinician, and as an educator, I feel it even more and more that maybe I don't. I've just gotten here by chance. Someday everybody's going to realize that I don't really know how good I am, or that I'm a fake, and this is all going to get taken away from me, and that's going to be very embarrassing. But realizing that this is a real thing is really important. And when you start to realize it, you can then start to see what type of struggles people go through. So it's not important that the person who is in perfect control, who is the model employee, is not going through any struggles in their life. You might recognize some of these in yourself, or you might recognize some of these in colleagues who are going through things. And always take the time. Invest your time in people in your team And you will see that you will accomplish a lot more than if you are focusing on the targets and the outcomes. So work on your teams, and your teams will work and deliver what needs to be delivered. How can you recognize people who are struggling? I mean, there's all these things that you might see. It's these behaviors, aren't there? So somebody who just goes, I'm all right, but you can't really tell, or their facial expressions don't say the same thing. People who are exhausted, who don't care, who are forgetful, who are always apologizing, or not turning up to meetings. So these are all signs of somebody needing support. And if you can identify them as a leader, then that probably is the best thing you can do for them. Internally, when I think about it, this is always a good way to see if things are within my sphere of influence or out of it. And if it's not something that I can influence or control, then worrying about it won't achieve much. So it's better to direct your efforts towards things that you can control. And then coming back to those feelings of inadequacy, it's okay. You can be you can be critical of yourself. You can dwell on an unhelpful thought. That is actually okay. But just keep telling yourself that it is okay. And you will start to accept those feelings. You will start to accept who you are. And as that judgment goes out of those feelings that you have, you might start to see some growth as well. It might also be a good time right now to stop for a joke, so I'll let you all read this. So just because you have imposter syndrome, it's still possible that you have it and you are incompetent. And I've got a few slides to talk about leadership, but I'll see we don't necessarily have to go through all of them, and the slide set will be shared with everybody. But as I said, a lot of these are infographics anyways. But if you think about what makes a good leader, the 3 C's of leadership are competence. You cannot be a good leader if you're not competent at what you do, at your prime job. Your character has to be something that is exemplary, so people look up to you, and you are the model or the example of the kind of person they want to be. And you've got to be very exceptional at communication. And these are all skills that you can learn. You can learn to be competent. You can improve your character at work. You can improve your communication. I believe that my being in the army probably helped me to pick up a lot of those skills to be a leader. And this is what the British Army, for example, talks about in their leadership competency framework. And it's exactly those things, isn't it? It's their character, their knowledge, and their actions. So how competent they are, how well they communicate, as well as what kind of character they have. But at the same time, being supportive and being empathic doesn't mean that everything has to be sugar-coated and you have to always be treading on those eggshells, and you cannot tell people things the way they are. It is possible to feel angry at somebody and control your response and tell that to them. It's possible to be kind to people, but set boundaries so that you yourself are not affected by what's happening. I think when we talk about being vulnerable and powerful at the same time is one of my favorite ones. A good leader will always share their vulnerability. So I always suggest that whenever you have an opportunity, start with yourself. Show that you are vulnerable first. I'll give you an example of this. I was involved in the care of a pregnant woman close to term who came into the emergency department in cardiac arrest. And we ended up doing a resuscitative hysterotomy or a perimortem C-section. And unfortunately, neither the mother nor the baby survived. And suddenly I was surrounded by two teams, a maternal cardiac arrest team and a neonatal cardiac arrest team. So we had two anesthetists, two ODPs, or respiratory therapists. We had 8 doctors, 7 nurses, a midwife, and a lot of emotion going around. So we knew obviously that we wouldn't be able to debrief in that situation, but tried to facilitate a hot diffuse, if you've heard of that term. So what we did was we suggested to everybody that they all speak in turn, but speak to me and not to each other, and tell me how they felt so that we could record everybody's emotions and record everybody's recollection of the event and what they felt was missing, and that we would have a debrief afterwards. It was challenging, but we managed to get through it in about 10 or 15 minutes. And then I said to everybody, thank you very much, everybody, for coming here. And especially those of you who don't work in the emergency department, coming to an unfamiliar work environment and doing the best you could to save this mom and this child. I have no doubt that everybody tried their best. I also have no doubt that no matter what we did, the outcome would have been the same. Having said that, it doesn't take away from how people must be feeling. And if any of you feel that you are not ready yet to go and see your next patient or to provide care to somebody else, this is, and I made a little box symbol, this is a safe place, and everybody is welcome to stay here for as long as you need until you feel that you can continue with your shift. If you feel you can't continue, please let me know and it is okay for you to leave. And I'll put my hand up and say, as the first person, I'm not ready to go and see a patient yet, so I need some time and I'm going to stay here. And it was just showing that vulnerability that allowed people who maybe would not have felt comfortable saying that they were traumatized by this, to stay back. And that's really important. So when people talk about leadership or think about leadership, they think that it's about being in charge, but it isn't. It's about empowering your team. It's about articulating your vision. It's about listening first and speaking last. It's about embracing people with empathy and developing their talent. So important to remember that your title or your own achievements don't define you as a leader or make you a leader. It's all those other things you do. And at the end of the day, if you have a team that respects you and is willing to follow you, that is what makes you a leader, with or without a title, with or without a sphere of influence. So I had a few slides about talking about different leadership styles. And again, I'll just share these slides with everybody and you can go through them. A lot of this information is well known and it's in the public domain anyways. But it's important to realize that emotional intelligence is probably one of the most underrated skills or assets or characteristics of a leader, of a good leader. And therefore, having that wide range of emotional intelligence, but in addition to that, you have to be intelligent to be a good leader, but you have to have that emotional intelligence as well. And if you think about it from an even broader picture, it's not just the emotional intelligence, it's social intelligence as well. Your ability to understand how things impact other people, how what you say impacts the rest of your team and other teams that your team interacts with. So I would say that, it takes a community of leaders, clinicians, educators. You can use that interchangeably to create a culture of kindness for other people. And that is going to drive your team well-being. And that is what's going to improve outcomes for your patient. It's going to if you have that team that is not just capable, but also resilient, and you in that team create that environment, that's when you're going to see not just the well-being of your team, but really meaningful improvement as we go along. But to get there, you've got to create that space where people can actually make mistakes and learn from them. And so you've got to provide them with that psychological safety, because without psychological safety, we're all stuck in just not wanting to be wrong or not wanting to make a mistake. It even holds people back from voicing concerns that are very valid because of the fear of being reprimanded or how they will be judged afterwards. So going through a few slides really quickly, that's what you learn as you step into more traditional leadership roles where you're actually in charge of teams or organizations. There's a lot of eye-opening moments and a lot of things that you realize. And when things go wrong, you've got to first look at yourself. But other things and tips and tricks that you pick up along the way are, what good leaders do. And that you'll often hear, and I'm sure you can remember a few of the leaders that you have picked up things from and would like to be like, would have used these phrases or something similar to these. And it's about empowering your colleagues, showing that you're there, you have their back. And when they end up in a situation where things aren't going well, you're going to step in. But it's about allowing them the opportunity to do things themselves. A good leader doesn't micromanage or do everything themselves. Trust their team to do the right thing. So in the end, I'd just like to say, no one is born a leader, but you can learn the skills to become one, and practice ethical leadership, in which not only are you aware of who you're working with, but you allow them to excel and you lead by example with a positive mindset. You'll see that there's a lot of green flags to leadership, not just red flags. But in today's day and age, especially in the media, if you think about what kind of leaders I learn from and I would like to be like, who's seen Ted Lasso, the show? And definitely. So Ted Lasso's leadership lessons: ignore the haters with clear goals of what you want to achieve. Each person matters, so give everybody a chance to improve themselves. You do that by teaching others to believe in themselves. But a good leader, and if you think about Ted Lasso, he knows nothing about football, but he surrounds himself with experts who can tell him what to do, whether that's Nate, whether that's the other coaches. And this strong belief that success is never dependent on the leader. Success requires teamwork. So leaders will show the way and light the path for others, because leadership is a process just as much as it is a person. And this is now really coming to the end. This is a quote from Warren Bennis from his book on becoming a leader. And that's the whole point of my talk today. The point is not to become a leader, but to become yourself, to use yourself completely with all your skills, gifts, and energies. You must become the person you started out to be. And while doing so, enjoy the process of becoming. Because I did talk a lot about imposter syndrome, there's some evidence-based strategies to help people overcome that imposter syndrome. And along with these slides, if I thought I'd probably end with some good books that you can go back to, not just on leadership, but on imposter syndrome and how to tackle it as well. So with that, I thank you very much. And Dr. Uzair, Professor Akhtar, I've taken a little bit of time more than I thought I would.
Thank you very much, Dr.
Thank
Immad.
you.
Should I stop sharing?
Yeah, it's
Yeah,
wonderful.
please.
And definitely, we realize the importance of soft skills. They are hardly talked about and they are hardly practiced and taught in any med school. So, where you start your journey, Pakistan is definitely missing many of these things for a variety of reasons. And it is really a good analysis how important they are. In the management and in the business world, yes, they put a lot of emphasis, but in the clinical sphere, I think the communication, the soft skill, the EQ is very little discussed. So it's just a very good analysis and a great thing. So we do have a couple of questions, but before that, I have a question from my side. I understand the importance of emotional intelligence, and they talk a lot for the success of leadership. And the clinical leadership is a very fine mix of both. We have Professor Akhtar as well. Day in, day out, they face the situation. And a nice blend of soft skill and the clinical skills and so many things. One of the most important trait you mentioned is about the other than the character is the communication. And many a time we have seen the people that you can improve the communication skill with the formal training, particularly the written one. But having the phobias, socially, people are shy to talk about. Do you feel, based on your experience as a supervisor, as a leader, that you can mention some of the people who are following you or the junior staff, where you pinpoint and you help them get over those phobias and to be a good communicator, a successful communicator, and to be a growing leader? Can you mention, some of your experience personally as a leader?
Well, thank you very much, Dr. Zair. In fact, this was something that we often identify, especially as international medical graduates abroad, but also in Pakistan, that communication is not really talked about that much in the clinical setting as well as outside the clinical setting. Um, and actually, Dr. Jabin and I have taught on some workshops on this, and we've developed a workshop that we've been running. I've been running it in the UK, and also when I go back to Pakistan at various for undergraduates as well as for postgraduate doctors. Because when we talk about communication, it's a lot more than just what you say. It's how you say it. It's what tone you use. It's your body language, and we teach all of these skills because sometimes what we don't realize is how a simple throwaway comment, which you didn't pay much attention to, impacts the relationship you're going to have with your team. And in the clinical context, let's say the patient and their attendants are also a team with us. We're trying to achieve the same goal. So I'll give you an example of one that left an impact with me. Had a patient who'd come in with an abscess and had treatment given, had surgery, had an incision and drainage, was put on antibiotics. And the nutritionist, this is in Pakistan. So nutritionist came and developed a diet chart for that patient. And we went to see the patient in the morning round, and there was a glass of milk next to the patient. And they hadn't drunk the milk. And he said, Bibi, dudh kyun nahi pita? Why haven't you drunk the milk? And she goes, Dr. Saab, if I drink milk, it's going to give me peep. I'm going to develop pus. So that's why I've not drunk it. Doctor, like, oh, Bibi, that's not how it happens. Drinking milk doesn't create any pus or anything like that. It's good for you. Drink it, okay? And he walked away. And I was still there at the bedside, and the lady turned to her attendant and said, this doctor doesn't know that milk creates pus. How can I trust him to treat my condition? So it was a very simple throwaway comment by the doctor, that if he'd taken the time to break that social norm and to actually explain it, might have achieved a lot, but ended up hurting his relationship and his rapport with that patient. So when we talk about supporting our juniors through communication and through, to become leaders themselves, this is the kind of training that we often provide them. In addition to that, we teach them about how to be assertive, how to raise challenges and concerns. Professor Akhtar, you are working in Toronto, so you must be aware of the PACE and the CUS methods of escalating concerns, which
Hmm.
we often do. So it's when you say, I've got a concern, this is not right, can you please
Hmm.
stop and consider this? Or I'm feeling uncomfortable, or this feels very unsafe. Please, can you listen to what I'm saying? And if that doesn't work, then you actually physically intervene and say, right, I want you to stop what you're doing and listen to what I'm saying because I have a concern and I want to escalate it. So using the right language and allowing that, again, psychological safety within your teams for people to be able to challenge is what the most we can do as leaders, I think.
Very well said, Dr. Qureshi. I think it's the way we explain. I must say to our juniors and students, um, I don't know that imposter syndrome is usually happens only the junior or the senior. To me, look like it's more when you achieve something, you get to a point when you are kind of a leadership role, and then you start doubting your skill set that, okay, sooner or later, somebody going to find it out. I mean, it's a kind of a feeling, not a fact though. And you do have it more and more. And I must say, must congratulate Dr. Immad Qureshi that he said this very important topic, which is kind of, if not 50%, but very majority of us keep doubting ourselves at one stage of our career. So it is very important to be aware of this thing, and so then you can address yourself first. So if you are not confident about what you're doing, then it will be very difficult to persuade others or lead a team. So one question, I think there are some questions I'd rather just ask myself. We will let the questions from the doctor that you're saying there are a few questions. If you can shout it out, so then we'll get a very
Yeah.
brief answer from Dr. Qureshi.
Yes, because we have to close sharp at time because there is a back to back another webinar. So I think the first question is, being a third year medical student here in Pakistan, how to start research from scratch, like meta-analysis and RTEs. I think if you would like to give a very simple answer, Dr. Ahmad.
No, absolutely. So I think being involved in research is very important for all doctors. You don't have to just be a producer of research. You can be a consumer. You can be somebody who appraises and publishes as well. So you can be somebody who's collecting the data as part of a research or as a study as well. So I think if you want to be involved in research from scratch, the first thing I'd say is to attend research training, whether that is critical appraisal skills or whether that is good clinical practice or guidance, which is a course that we run in the UK, which is run by the National Institute for Clinical Excellence, or NICE. And NIHR as well, so the Institute for Health Research. So if you start with collecting that set of skills so that you are aware of how you go about doing research, and then the next step, if you want to do randomized control trials, for example, will then be coming up with a question that is relevant, that needs to be answered, and don't just do research for the sake of getting research done. Any research
Sure.
that we do has to be relevant and has to answer a question that informs practice. Whether it informs a change
Sure.
or not is not important, but having relevant questions that we are researching is very important because it's very expensive to conduct research.
Thank you.
Yeah.
Can we have one more question, Dr. Zed? something
Yes, we
short and
quickly,
then
just that is just a very philosophical how to be a good follower, especially when you do not have an ideal leader. So that is a very, philosophical and a long debate oriented. And the next one is how should we deal with colleagues who are emotionally challenged most of the time? So these are a very deep psychological question. I don't know how simply we can respond to this thing, but Ahmad, if you have a one or two sentence really to sum up
Perfect,
this.
thank you. Yeah, and there's one in the chat as well as how to deal with burnout. So all I'd like to say about all three of these is the most important step is to recognize. If you recognize, you will be able to find solutions. Just like in medicine, the most difficult thing often is to diagnose. Once you have a diagnosis, there are hundreds of textbooks that tell you how to manage the situation. So, similarly, being empathic and being that person who is investing in people so that you can identify that your colleague is emotionally challenged, who can identify that somebody is burnt out, is the first step. And once you
Mhm.
identify and diagnose, then it becomes easier.
Thank you very much,
Thank you.
Dr. Ahmad. Yeah, it's really so different, and sometimes we must give this type of activities due place.
Yes.
It's fantastic, the response. Look at the people, how they responded, how interactive was the session. Phenomenal. So great, great thanks to Dr. Ahmad for such a nice and very pictorial, not challenging to your brain, but you are absorbing in your memory. Fantastic. All the best. So with this,
Mm.
we are going to close this session because there is going to start the next session in a few minutes. So thank you very much. And Professor
Yeah.
Akhtar, thank you very much a lot for your valuable time and putting all the effort and time, and our technical team, and most important, our participant who always participate. Thank you very much indeed. And we are thankful for your comment, for your participation, for your feedback. All the best. And see you next month, same time. Thank you very much.
Yeah.
All the best.
Thank you. Bye. Bye-bye.